Every week I get contacted by people either coming to see me or through email or phone calls who are worried about their child because they have identified an additional need, but there are no services available in the foreseeable future for that child. I want to give an example of, say, one set of parents who contacted me last week about their son James, who's aged 5, and he's just started school. He was referred for OT at a 4-year checkup by his public health nurse, because both the public health nurse and indeed the parents had concerns about his fine motor skills and his gross motor skills. But he was refused access to OT and told, because you're already on the physio list, because he, as a baby, for a totally unrelated issue, he'd received physio. He had to go back to physio, and they said, OK, we'll take him in and assess him, which they did, and they referred him to OT. And again, as they pointed out, the issues with his fine motor skills were vital that they be addressed as he was about to start school. Anyway, in the meantime, he has started school, and the school has identified the issues as well. And while they're very supportive, they're not therapists, and they don't have the knowledge and the expertise to assist him to the extent that he needs. While doing a speech programme in school, they've actually identified that he has significant speech delay as well. And he had been referred for speech and language at the age of 2 because he hadn't spoken at that stage. He waited 2 years for speech and language, and by the time he was accepted onto the list, he had started talking, and they said, "Ash, you're fine." They've left him. Had they addressed the issues then, he wouldn't have speech delay at this stage. Now he's been referred back to speech and language. But the parents are most concerned about the OT and the need for OT. The OT came back and said, OK, we'll accept him onto our list, but it will be up to 3 years before he is seen. And they actually can't say that that's definite because it is dependent on resources, that is staff. So he potentially will be 8 before he is seen by an occupational therapist. He will have missed out on so much time within that. Like, the parents could pay privately, but they can't afford to. But even if they could, it's very difficult to access a therapist. And many people I know are actually getting into debt, having to pay out the money for therapists that they should be receiving from the state. Another little girl, Maeve, she's almost 3 years old. She's deaf in one ear. She ordinarily requires speech and language. She's on a waiting list for over a year. She was referred for speech and language therapy in September of 2024. When I contacted primary care, they told me it'll be early 2027. So we're talking about 2.5 years in total that she will be waiting. Again, Maeve's parents can't afford to pay privately. But they were saying that she requires the early intervention to prevent her experiencing developmental delays. Now, I looked at the lists in Cavan and before the end of last year, and there was 810 waiting for a first-time assessment with occupational therapy, and over 500 of them were on that list for over a year. And it was by far the longest list. Well, actually, speech and language was the longest list. There was 1,604 awaiting initial assessment for speech and language in Cavan Monaghan. That's not including initial therapy, or it's not including those waiting for further therapy. So the HSE has compiled, extensive data on this, so they know there's extensive delays. The CDNTs are also, and I know it's a different department, but they have a huge waiting list as well for both assessment of need and for services and therapies. And the staffing in Cavan CDNT was a huge issue of concern. Now, it has improved, and I have to acknowledge that. There's only a small number of vacancies, but there's a huge waiting list. And even if they have a full complement, a full team complement, I don't know how they're going to address all of those that are on the waiting list from the time that they didn't. So, and even if I'm not even sure that the team is actually big enough when it's fully compiled to address the need that's there. Thank you.
Gurmagat Laskerlik, and may I extend my gratitude to the Senator for raising these pertinent issues and particularly bringing light to the cases of James and May and indeed their families. As you know, the relevant ministers are currently in the Dáil answering oral parliamentary questions, so that is why I'm here. Senator, the Government fully recognises the importance of early intervention for children with disabilities in Ireland, including those living, of course, in Cavan. In early 2023, the Specialist Disability function transferred from the Department of Health to its current department. This ensured appropriate focus was given to the challenges being faced by people with a disability. Under the programme for government, the Government is committed to ensuring children and their families who need early intervention and therapy input can access the support in a timely way. Under the roadmap, Children's Disability Network teams continue to deliver support for almost 1,000 children with complex needs, and despite increasing demand for services, the total number of children awaiting services has continued to fall nationally. Since the implementation of the roadmap was approved, this national CDMT waiting list has reduced from circa 16,500 to closer to 10,000 children at the end of September of this year. The Children's Disability Network team staffing also remains a key priority. The most recent CDNT workforce survey conducted outlines 2009 posts filled in CDNTs, and there were 445 posts vacant as of April. This survey outlines continued growth in staffing in all regions and a corresponding reduction in vacancy rates. There is an overall national increase of 8% in staffing in CDNT's workforce compared to the workforce as of the last survey in October 2024. This means there is an overall reduction in unfilled posts from 29% in October 2023 to 18% in April 2025, and an overall growth in workforce of 415 whole-time equivalent staff since October 2023. Government has continued to make funding available in 2025 for children's services. Senator, speaking on Cavan specifically, the HSE have advised that the total number of children receiving services in a CDNT at the end of November stands at 380. Children on the waiting list at the end of November stands at 194 children, 172 of those waiting over 12 months. Therefore, to tackle these challenges, waitlist supports and initiatives have been put in place in CDNT services in Cavan, such as diagnostic assessments, cognitive assessments and discipline-specific assessments outsourced to private providers, use of therapy assistant posts to support clinicians and service provision, and the use of recruitment agencies to source staff where Enable Ireland's normal recruitment pathways have been successful. The HSE have advised also that staffing levels have improved in the last 12 months, and the local team is systematically working through the longest waiters on the waiting list, and you yourself acknowledge that in relation to staffing. The Minister does reaffirm, however, that the Government, the HSE and its funded agencies remain committed to the delivery of appropriate services for children with disabilities and their families, and to continue enhancing services. And I suppose I provide that reply, Senator, not in any sort of political or combative way, but to try and say that you outline very real stark concerns about the kind of upper end waiting times that these poor children that you have raised the case of in the chamber may be facing into. And I wanted to just provide the real context that we're aware of that, we're acknowledging that. However, we are committed to putting the resources in, and are putting the resources in, which hopefully will lead those waiting lists to come down and make sure those children, more importantly, will be seen a heck of a lot sooner than perhaps is thought of at the moment.
Thank you, Minister. And I just want to acknowledge, like, the two examples I raised are in relation to primary care, but there are waiting lists for both primary care and CDNT, and there's actually a lot of frustration even when children are referred from one team to the other, and confusion around that. And I know they're two different departments, but they're all HSE or HSE / Enable Ireland. In relation to the CDNT, and I know, as I said, the staffing levels have improved, but there is considerable frustration from parents still around the lack of actual assessment. There's a lot of, say, courses being run for parents and how to support their children, and parents are more than willing and able and happy to do those courses, but they're saying the children need the actual contact with the therapist, and that's not happened to the extent that it should be. Some children have had no actual engagement at all with the therapist, and yet, or very limited, and the parents are watching the children struggling, and the same happens with the primary care, and the primary care lists are extremely long. And I'm just wondering, what plan has the government to try and address this? I mean, there needs to be, a workforce plan to put in more speech and language therapists, occupational therapists, indeed, I could go on, physiotherapists and so on. And the two examples I raised, I could have raised any number of examples of different children in similar circumstances. Thank you.
I think it is important to recognise that those two specific cases were very clearly brought to this chamber, but I know they're a representative of a much wider cohort, not just in Cavan but around the country. But you were right, what is the workforce plan, what is the solution to make sure that those children don't just get assessed in time but get that one-on-one contact with the therapist that they need. And Budget 2026 has provided €20 million for the delivery of some 6,000 clinical assessments through the targeted waitlist, and a further €8 million has been secured in the budget to allow for the funding of 150 additional posts to the Children's Disability Network teams. Over the last 5 years, the disabilities workforce in the HSE and Section 38 providers has grown by over 21%, and this is the key issue, and it's mirrored, Senator, in relation to additional places in our third level institutions. We need more staff. The more staff we have, the more people will get their assessments, the more people will get their therapies, and we're working on a concrete plan to make sure that's rolled out in a timely manner.